Welcome to Healthcare Musings, a podcast dedicated to the discussion of critical care and healthcare in general. Here's your host, Dr. Hassaballa.
Hello, everybody. Happy to have you with me. So I have a faculty position at Midwestern University in Downers Grove, Illinois, and classes for medical school started this week. I have faculty position in the Chicago College of Osteopathic Medicine, and I'm very happy to have it. And I look forward to continuing to teach the CCOM students. And classes started this week, and so wanted to share my advice to those students who are starting their medical careers this week by going to med school, with classes. This is the time. These first 2 years are absolutely critical for the entire rest of your career. Those clinicians, those physicians who remember the lessons and the learning that they received in these first 2 years will be leagues better than their colleagues. Medical education has changed. The philosophy of teaching has changed. It's way different than when I was in med school back when the dinosaurs roamed the earth. And I think some of it is good. Some of it, you can argue. At the same time, the fundamentals haven't changed. The basic science has evolved. We've learned a lot more, and still anatomy and physiology and pathophysiology, while we've learned a lot more, are still the same. And those medical students who know the anatomy and physiology and pathophysiology and pharmacology and biochemistry and continue to use it and remember it will just be that much better as doctors. There's no question about it. A lot of us in med school learned it and then we're quick to forget it. And I tell you, it just makes you a worse clinician coming off because you don't remember basic physiology and basic pathophysiology, and you are liable to harm patients. I see it every single day in my practice as a critical care specialist and pulmonologist. People don't remember the pathophysiology of chronic respiratory failure and acute and chronic respiratory failure, and they can potentially harm patients because they don't remember the physiology. They just react to an abnormal number. It's absolutely critical, and I mean it with every sense of the word, that the things you learn in the first and second years of med school are absolutely essential to your success as a third year and a fourth year student when you do clinical rotations on the floor. And they're absolutely essential to your success as a medical resident. And then they're absolutely essential to your success as a physician, no matter what you do. The things you learn this year and next year, remember them. Internalize them, always keep them in the forefront of your mind because they apply every single day when you see patients, no matter where you are. It's absolutely essential and critical. Don't forget the things we learn in these first 2 years because it'll just make you that much of a better doctor. All the best to all the medical students starting this week, and then the subsequent coming weeks. And I'm so very happy for all of you, and welcome to our field. Thanks so much for your time and attention. And until next time, this is Dr. Hassaballa signing off on the Healthcare Musings podcast.
Thank you for listening. To get every episode delivered directly to your inbox, please subscribe at healthcaremusings.com.